All right, so next on the agenda is we are going to hear from Dr. Kenny Fent from the from NIOSH about the National Firefighter Registry. He will be joining us online.
Hi, I'm Kenny Fent. I'm a research industrial hygienist at NIOSH. I'm also the team lead for the National Firefighter Registry program. Thank you for this opportunity to provide an update on the NFR, and thank you to the conference organizers for setting up this conference. So I'm sure, as many people in the audience know, there's over 1 million firefighters in the United States that protect our homes, communities, and environment. Every year, these firefighters respond to roughly 1.4 million fires, 500,000 of which are burning structures. Exposure studies have shown that there are hundreds of compounds released from burning materials. Over a dozen known carcinogens have been identified on the fire ground, and even more probable and possible carcinogens have been measured as well. So this is an exposure pathway diagram, and it illustrates just how complicated the exposure process can be for firefighters. It's not just what firefighters may inhale during a response, but also what may contaminate their PPE and equipment or transfer to their skin, off gas from their gear, and so on. Just over the last decade, a number of epidemiology studies have provided evidence of a link between firefighting and cancer. One of the pivotal studies that was conducted actually by NIOSH, called the 3-City Cancer Cohort Study, found an increased risk of being diagnosed and dying of certain types of cancer compared to the general population. Several other cohort and case control studies have also found elevated risks of specific types of cancer. However, the cancers have varied across the study populations, with important differences by sex and race. But the data for women and minorities have been sparse and generally lacked sufficient power to draw conclusions. A few studies have identified exposure-response relationships, but that data has also been limited. By looking at past studies, we can make some conclusions, but also, these conclusions can lead to additional questions or knowledge gaps. Studies generally report a link between firefighting and cancer, and certain cancers are consistently elevated with some variation in risk estimates. We know that some of that variation is probably caused by how firefighting status is ascertained. There's also disadvantages to classifying firefighters based on state cancer registry data or fire service records alone. Additionally, little information exists beyond simple occupational status. Few studies have been able to analyze exposure response relationships using incident records, and that includes the NIOSH 3-City study. But there is a lot more to evaluate. What is it about firefighting that may increase the risk of cancer? Analyses have demonstrated that cancers among demographic subgroups appear to be consistently inconsistent, meaning that there hasn't been much consensus about which cancers are elevated among select groups of firefighters. But it does appear that women and minority firefighters, who comprise roughly 8% and 20% of the fire service respectively, may have unique experience as it relates to cancer risk. A lot is still to be learned about how the risk of cancer varies by demographic subgroups, subspecialties of firefighters like volunteers, who represent almost 70% of the workforce, or wildland firefighters, and across different regions of the country. Some past studies have indicated that the magnitude of risk associated with firefighting may still be small compared to some lifestyle risk factors like smoking. But most studies haven't been able to account for personal and behavior risk factors for cancer and how those may interact with occupation to affect firefighters' risk of cancer. So in short, there's no central or comprehensive sources of data that provide details about firefighters' occupation, personal risk factors and behaviors, and cancer status on a national level. So those knowledge gaps, along with support and advocacy by fire service professional organizations, were really the primary drivers behind the Firefighter Cancer Registry Act of 2018. And that act mandated that CDC NIOSH develop and maintain a voluntary registry of firefighters to collect relevant health and occupation information for purposes of determining cancer incidence. The goal of the National Firefighter Registry, or NFR, is to evaluate cancer and risk factors over time to better understand the link between workplace exposures and cancer. Our mission is to generate detailed knowledge about cancer in the fire service through a voluntary registry that reflects our nation's diverse firefighters. And our vision is to equip the fire service and public health communities with the knowledge they need to reduce cancer in firefighters. So that's the ultimate goal, right, is to reduce cancer. Lastly, with input and guidance from our Nfr Subcommittee, which is a federal advisory committee consisting of fire service, medical, and scientific professionals, we established several primary components of the NFR. Number one, to collect self-reported information on workplace and personal characteristics through an online web portal. Number two, to obtain records from fire departments or agencies to track trends and patterns of exposure. Number three, to link with health information databases, including state cancer registries and the National Death Index to detect cancers and death. And then to make de-identified data available for external researchers. So it's really important to note that all firefighters will be strongly encouraged to join the NFR, not just those with cancer. The NFR really is more of an exposure registry than a cancer registry, which is essential for understanding the differences between firefighters who do and do not develop cancer. Firefighters' participation in the NFR is totally voluntary, but we do hope to enroll 200,000 or more firefighters, and we'll have a recruitment emphasis on women and minorities and volunteers as specified in the Act, and those are groups that have largely been understudied. We're also interested in various subspecialty groups that have also been understudied, such as instructors and wildland firefighters and fire investigators. There will be 2 enrollment routes as part of the NFR. The open cohort will be a non-probability sample in which any firefighter, active, former, or retired, will be eligible. This enrollment route is beneficial for recruiting a very large and diverse sample, but unfortunately may not be generalizable. The targeted cohort will be a prospective cohort of active structural firefighters recruited from selected fire departments or state agencies. And the targeted enrollment route allows us to select firefighters throughout the country from geographically diverse departments of various sizes, and it's less susceptible to selection bias than the open cohort. This design will also allow for focused enrollment of women and minorities and volunteers, and also allow us to access incident records for more detailed exposure information. The way in which firefighters will enroll is still under development. This is taking the longest time, mainly because data security is our top priority, and there are several new federal data security requirements that we must comply with. It's absolutely critical that we get this right the first time. And so even though the web portal is still being developed, we do plan for enrollments to involve, number one, informed consent, number two, a user profile, and number three, an enrollment questionnaire where we'll collect information on demographics and work history, lifestyle and health history. We do estimate that enrollment will take about 30 to 45 minutes, where newer firefighters will be on the low end and more experienced firefighters will be on the higher end of that estimate. And that's simply because, more veteran firefighters will have more work history experiences to report. We also want to make sure that firefighters can log out and log back in and pick up where they left off, because we know that firefighters, may get a call and have, other responsibilities they have to tend to. So we're also interested in capturing data from other sources to better understand firefighters' exposures. And that includes fire department records, like incident records, and exposure tracking data. So, if firefighters are going to the trouble to track their own work-related exposures, it stands to reason that they would also desire to share that information with the NFR. So the NFR enrollment system or web portal will be computer, tablet, and mobile friendly, and it will also work, or should work, on all browsers. Firefighters will be able to set up an account via login.gov, which is used throughout the federal government, and that will utilize multi-factor authentication, which most of us are familiar with, where you would enter an email, a password, and then receive a code via text message. After establishing an account, the firefighter will electronically sign a consent form, and those first steps should be relatively quick. After setting up an account and providing informed consent, the firefighter will then be able to complete a user profile, including name, address, email, and mobile phone, and a preferred method of communication. Our plan is to provide regular updates and other helpful information to firefighters to register. That way, we're able to keep them engaged in the NFR and related research. And this process should also be relatively quick. Once they complete the user profile, the firefighter will be taken to an enrollment questionnaire. And this is really the most important part of the registration process, where we'll ask about demographics and work and exposure history, lifestyle, and health history. And this is important for understanding the occupational and non-occupational risk factors for cancer outcomes. This part of the enrollment process will take the longest, probably about 30 minutes. But the firefighter can log out and back in, as I mentioned. Once the questionnaire is submitted, the firefighter is fully enrolled at that point. After completing the enrollment, the firefighter will still have access to useful information, including a dashboard that contains summary statistics about the NFR, resources such as research papers or recommendations, and other research opportunities, for example, like the FFCCS. And eventually, it'll include follow-up questionnaires. We expect to develop new questionnaires that are available to complete on an annual basis. Those questionnaires will likely be smaller than the initial enrollment questionnaire, and could focus on specific groups of firefighters, such as female firefighters, for example, or exposures or health outcomes. We do plan to work with our external partners on developing these follow-up questionnaires. And again, these follow-up questionnaires will be completely voluntary. So the slides that I just showed are, still in development. So the final look and feel will be a little bit different than what you just saw. After enrolling hundreds of thousands of firefighters, the next step will be to conduct health outcome linkages. We understand and can appreciate that if a firefighter is diagnosed with cancer, the last thing on their mind will be to report their cancer to NIOSH. So instead, cancer information will be determined by periodically linking information collected through the NFR with data from state cancer registries to determine cancer incidence, and to the National Death Index to determine cancer mortality. The North American Association of Central Cancer Registries has a new virtual pooled registry, and that will also be a useful asset for conducting linkages. Social Security number is an important identifier for accurately linking health outcome databases. So, based on input that we got from the Nfr Subcommittee and fire service stakeholders, we've decided to ask for the last 4 digits of the Social Security number. Partial SSNs, along with other identifiers such as name, date of birth, and residential address, will allow us to confidently match to state cancer registries. This figure provides a nice visual aid for the data sources that we'll be capturing. The NFR web portal is the common denominator among all the NFR participants. That's how everybody will register. But again, we'll also be trying to capture, department records and exposure tracking data, and all that information will be funneled into a secure NFR exposure database that is later linked to health outcome databases, namely the state cancer registries and the National Death Index. The Firefighter Cancer Registry Act states that we should ensure that information in the NFR is publicly available while also protecting the personal privacy of participants. So we're in the process of obtaining an assurance of confidentiality, which is the highest level of protection allowed by the federal government. And it can assure participants, fire departments, and other institutions like state cancer registries that NIOSH will protect the confidentiality of the NFR data. We're also pursuing a secure mechanism for making de-identified data available to external researchers via the use of research data centers, which are federal data warehouses responsible for protecting the confidentiality of participants while providing access to restricted use data to external researchers for statistical purposes. So we've made a lot of progress over the last year, especially, and we're basically ready in terms of all the scientific elements. So right now, all eyes are on the development and rigorous testing of the NFR enrollment system, which we do expect to launch in the summer of 2022. After we launch, firefighters will be enrolled continuously over several years and will collect important data about their work as a firefighter. Although cancer outcomes and linkages will take many years, we will be able to start analyzing other data, including the self-reported exposure information, which will be of great interest to researchers and fire service leaders. So in summary, the NFR will be the first national registry to improve our understanding of cancer risk in all types of firefighters. but its success really depends on participation rates. We need strong fire service advocates or champions throughout the country. So please visit www.cdc.gov/NFR to learn more and sign up for our newsletter. That'll be the best way to stay informed on our progress and the launch of the NFR later this summer. In the meantime, we'll be working with professional fire service organizations and others to demo and test the Nfr enrollment system, as well as communicate the launch of the Nfr. We know we have to work hand in hand with our fire service partners to really get the information out there. We'll also be having conference, exhibit booths where we can get the information out, and then we'll be connecting directly with fire departments throughout the United States. So thank you for your attention, and again, thanks to the conference organizers. This is an amazing conference to learn about all the great research that's happening across the United States associated with firefighting. And we look forward to working more closely this summer when we get the Nfr off the ground. Thank you.
Thank you, Dr. Fent.